Hi everyone, I'm Dr. Kiran Martin. I'm the founder and director of Asha. Asha is a voluntary organization that's been working in the slums of Delhi for the past 33 years, and we are looking after a population of 700,000 slum dwellers through approximately 100 slum colonies that we work in. I'm here today to give you an update on what's happening with regards to COVID-19 in Delhi and in India. So, in the last 24 hours, we've had more than 450,000 cases of COVID all over India, and this has been the highest figure so far ever since the pandemic began. Things are continuing to be very bad in Delhi. We had 25,000 cases or so in the past 24 hours with approximately 400 deaths. The situation in the hospitals in Delhi, whether they are public or private, is really horrendous. Patients are lying outside hospital gates, not able to get a bed. They are gasping for oxygen because there is no oxygen available outside, and they are not able to get into the hospitals. Hospitals have got huge oxygen shortages, and even the patients who have been admitted in these hospitals are not able to get enough oxygen. Asha has a team of doctors, nurses, health assistants, healthcare workers, and Asha Corona warriors. And this team is being led personally by me, and we have strategized and planned how we are going to help our entire community. For those who are very critical patients, these are patients who have been refused hospital admission. They have gone from one hospital to another and just not been able to find anything, and the patient's family has come to us and begged us to help in whatever way we can. So, without giving any guarantees and saying to them that as a last resort we are willing to try some treatment on you, and even though we didn't have any oxygen ourselves, we gave nebulization with steroids, we gave high dose steroids, and we gave anticoagulants and hydrated the patient well. And surprisingly, actually, to me, a lot of the critically ill patients started recovering, and their SpO2s were ranging from 50 to 80, 85, and I actually thought perhaps we might lose them, but the wonderful care that has been provided by our nurses and warriors who have not hesitated to go inside the homes of these patients and treat them with much diligence and much dedication under my instructions has meant that the patients have received top quality care, and they have been very rigorously monitored, and that is why these patients have been able to come out of a crisis and out of the severity, and now are doing quite well. With regards to moderate patients are going into severity very quickly many times, and so we have instituted protocols that will cut the severity of the disease and not allow the SpO2s and oxygen levels of patients to go down to this extent that they require oxygen. And we have been very successful in this treatment by giving high dose steroids, anticoagulants, as well as frequently nebulizing these patients with steroid respules. So, this we have found has cut short the severity of the disease, and patients with moderate COVID, which are present in all of our slums, almost all the slums that we are working in, are being very successfully treated by Asha. And of course, if the SpO2 falls in spite of our best efforts, then we immediately say to the patient that they must go to a hospital, and only if the patient refused hospitals and has no other way to be managed, then Asha will be able to help them. As far as mild cases go, those abound everywhere, and those are very dangerous because they can go into moderate and severe COVID, and it's very unclear which patients will go and which patients will not. So, we have instituted a protocol for all mild patients, and that protocol is being followed in all the Asha slum communities. With regards to RT-PCR tests, I just wanted to let you know that this test is not available in Delhi at this time in our public hospitals. It's very expensive in private hospitals, and therefore patients can't afford to get it done. And so we are relying on the clinical symptoms and signs to be able to assess whether we think this patient has COVID or not. Also, patients who are showing symptoms of COVID and have a history of being in contact with COVID positive patients are also being treated as patients who have COVID. Now I come to the whole idea of what we are doing with regards to spreading awareness in the entire population. So we have this team that I mentioned, and they are going from home to home and from lane to lane. They are patrolling every single corner of the slum. The whole team is going out, and they are identifying patients who have COVID-like symptoms and are immediately be referring them to our health team to start them on treatment. They are also distributing medical masks, 3-layered medical masks to every single person in the community. We are encouraging double masking because this particular variant that we find in Delhi, B.1.617, is a highly contagious variant and spreads very rapidly. With regards to vaccinations, the vaccinations from age 18 upwards were to begin on May 1, but unfortunately we do not have the supply, and therefore it is really hard to get vaccinations yet for those who are below 45. But we are still going to be trying our utmost best to get the entire Asha population vaccinated whenever the vaccine is freely available. But in the meanwhile, we have been successful in vaccinating the entire Asha team as well as all the Asha warriors, and that I think was something very important that we needed to do because it's so risky to be out in these communities and not be vaccinated. We are also making sure that within the public toilet complex, which is where most of the slum dwellers go, that there is a separate set of toilets for those who are COVID positive so that they do not infect others. Apart from that, we are also encouraging people to be very careful while filling water, because when it comes in a common tap at a certain time of the day, there are lots of people who rush to fill water in their cans and buckets, and that becomes a reason for rapid COVID spread. Social distancing is a huge problem, as you can imagine, in a slum community. We are encouraging all relatives of patients, if they are not able to isolate themselves, then they must wear N95 masks at home. I want to take this opportunity to thank every one of you who has so generously contributed to help us. Without your contributions and without your good wishes, we would have absolutely never been able to tackle this pandemic the way we have been doing during this second wave and this horrendous crisis that has presented itself before us. I just want to say that I am myself going to all the different slums because I think that leaders must lead from the front, and they must inspire their teams to be brave and to be filled with courage, and also to be able to provide compassionate care fearlessly to their patients. It is the job of every doctor and health worker to care for sick patients. There is nobody in the slums except Asha. I have been going for so many days, and I have found that except for the Asha team, there is absolutely no one out there except the residents themselves. And I can understand that, people are afraid, and going into a slum at the time of a crisis like this is a very scary thought, and therefore most people have completely abandoned the slum community members. Our team is working among 700,000 slum dwellers, and our entire team and warriors are busy from morning until night providing care to all our patients and also the whole population. I appeal to you for all this equipment that we require desperately. Please send us the resources so that we may be able to purchase this equipment. We require thermal scanners, nebulizers, pulse oximeters, investigation strips and reagents, equipment for investigations, BP apparatuses, weighing machines for COVID patients all have to be separated. Drugs and therapeutics such as antipyretics, analgesics, steroids, anticoagulants, bronchodilators and steroids for nebulization, drugs for COVID prophylaxis, vitamins and minerals, plenty of oral rehydration solution. We also require PPE for the Asha team, Asha warriors and community members in the form of N95 masks, 3-layered medical masks for mass distribution, surgical gloves, shields, sanitization supplies and sterilization supplies. There is urgent need for relief for families that are destitute, widows, the elderly and the disabled. We require high calorie, high protein supplements for malnourished individuals, financial assistance for the Asha Corona warriors and funds for logistics, which include transportation all over the city in the form of Asha vehicles or public transportation. It is not advisable for you to send equipment from your various countries to Asha because it's very tedious. Clearances are required at both ends. It is far simpler and cheaper for you to make donations of whatever amounts that you are able to, and for us to be able to purchase all this equipment and all the items that I have mentioned on this list locally. I thank you so much once again, and I know and I am sure that in the spirit of our common humanity, every one of us can stand together and fight this fight and be able to overcome COVID and once again begin to lead normal lives. Thank you.